We're not at the point of mandating masks. We're not at that point yet. We're not at the point of doing anything other than urging New Yorkers, while you're indoors in large settings, social settings, wear your mask. We have more tools, so we don't have to fight the war we had before. This is a new war, and we're going to use all those tools to do so.
New York City Mayor Eric Adams opting against reimposing an indoor mask mandate, even as the city transitioned to a new high alert level despite the vaccine. The U.S. is again seeing not only a rise in cases, but hospitalizations. Here to discuss is White House coronavirus response coordinator, Dr. Ashish Jha. Good morning, Dr. Jha. It's great to see you. We now have the daily case number more than 100,000. I know you think the number is actually higher because of home testing. So what is your advice in these high transmission areas?
Good morning, Martha. Thanks for having me back. First and foremost, my advice is if you have not gotten vaccinated in the last 5 months, if you have not gotten boosted, you need to go out and do that now. Now is a good time to do it. What we know is vaccines continue to provide a high level of protection against people getting seriously ill. So that's advice number one. Advice number two is I agree with Mayor Adams that when you're in indoor space, you should be wearing a mask. I feel that very strongly, that in crowded indoor spaces, in places with high transmission, people should be doing that. And our job, certainly in the administration, is to make sure that people have access to masks, people have access to vaccines, access to therapeutics, and testing. All of that we're working on as well.
And of these infected people, how many are quite sick? Is this part of what people see and they think, oh, it's not so bad? Maybe people aren't as sick. This is just part of life now.
Yeah, well, I wouldn't say it's quite part of life in the sense that I wouldn't say it's quite back to sort of normal, because, look, we have a lot of infections out there. It's still quite disruptive, and 300 people a day are still dying of this disease. That's way too much. What I would say is we've certainly started really breaking that link between infections and deaths through two mechanisms, right? One is by getting people vaccinated and boosted, and second, through making therapies widely available. Those things really do help a lot, and that's why, despite how many infections there are, death numbers are still relatively low. We've got to keep working on it. We're just not done yet.
And I know you have to keep working on it, but given that a lot of people aren't following your advice, I've been flying around the country lately, people don't have masks on. Give us a sense of what discussions are going on in terms of approaching this in a different way. You've said month after month after month, put your masks on, get a vaccine, get a booster, but the numbers aren't really moving. So what kind of discussions do you have about another plan?
Yeah, so look, there are a set of things that we know about how to fight this pandemic, right? They are many of the things you've mentioned. So we don't have a new set of tools that we're going to roll out. The ones that are, the ones that work, vaccinations, therapies, testing, masking, and improving indoor air quality. Those are the major tools. The discussions going on that we have is we're looking at the numbers and asking which of those tools are most important at this moment. Which ones do we want to emphasize? Certainly, I think we want to help people understand that we are in a different moment than we were 2 years ago, right? We are at a point where lots of people are vaccinated and boosted, where we do have widespread therapies available. We're not in the same battle, as Mayor Adams said, we're not in the same battle as we were 2 years ago. And so the key discussion now is how do we help Americans through this moment? And this is really important, Martha, how do we prepare for future variants? How do we prepare for the evolution of this virus? And how do we make sure we have the resources to do it so we can protect Americans as this virus continues to evolve?
And let's look ahead to the fall. I know you are expecting a surge. The New York Times reported that experts say the administration should be doing a better job of preparing the public for a reinvigorated virus in the fall and winter. What more could you do?
Well, there are two sets of things we can do. I mean, first is we should be communicating, as we are, and we do this every day, communicating what's happening with the virus and where our expectations are and what we're planning for. What we know is that this virus is evolving very quickly, and every iteration of it is, has more and more immune escape, makes it harder for people to, harder for this virus to be contained unless we continue vaccinating people and keeping people up to date. So that's what we know. We also are planning for a variety of scenarios scenarios, including a wave of infection this fall and winter, and making sure that we have a new generation of vaccines that are being worked on right now, that we have availability of treatments and testing, and we have the resources. By the way, one of the reasons I've been talking a lot about the need for Congress to step up and fund this effort is if they don't, Martha, we will go into the fall and winter without that next generation of vaccines, without treatments and diagnostics. That's going to make it much, much harder for us to take care of and protect Americans.
And CDC advisors recommended boosters for kids age 5 to 11 this week. But what about 5 and under? How soon might we see that?
Yeah, I have a lot of friends who have kids under 5. They're feeling frustrated, and I'm very sympathetic. What I know is that Moderna has completed its application. Those data are being looked at very closely right now by FDA experts. And my expectation is that as soon as that analysis is done, probably within the next few weeks, we're going to get that expert outside committee, the VRBPAC, and then after that, FDA is going to make a decision. So my hope is that it's going to be coming in the next few weeks.
And let's talk about this monkeypox. We've heard about that. President Biden says we should all be concerned, and if it spreads, it could be consequential. Give us a little update on that, and how concerned should we be?
Yeah, so let's talk about what we know right now. This is not a new virus to us. We've known about this virus for decades. We have a case in Massachusetts at Mass General. We have at least one confirmed case in New York, tracking others. I would not be surprised, Martha, if we see a few more cases in the upcoming days. And I think the president's right. Anytime we have an infectious disease outbreak like this, we should all be paying attention. But I feel like this is a virus we understand. We have vaccines against it. We have treatments against it. And it's spread very differently than SARS-CoV-2. It's not as contagious as COVID. So I am confident we're going to be able to keep our arms around it. But we're going to track it very closely and use the tools we have to make sure that we continue to prevent further spread and take care of the people who get infected.
Okay, thanks very much. That's good to hear. Thanks, Dr. Jha.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.